And on my way. We are so excited tonight to bring you this Semaglutide Empowerment Masterclass. We have some very special guests on with us tonight, including Dr. Casey Bond, Jepson, and there's that echo. 1 second, guys.
You'll have to unmute, Crystal.
Thank you. Yeah, we are very excited about this lineup tonight. Hey, as you guys are jumping on, go ahead and mute your phones. We're going to keep you muted because we are streaming this live. We have a ton of people getting on. We already have 200 people on this broadcast, and we have more watching us live in On My Way. So we're going to give it another 30 seconds and we're going to keep admitting because we have people jumping on like crazy. So if you guys are excited for this, jump in the chat. Let us know. Let us know where you're watching live from, what city and state. We're so excited that you could be here. We are excited to have you. Tell us what you're curious to learn about tonight. Are you taking notes? Are you tagging people in this live broadcast? We want to know all the things. And as you hear something that might relate to you, specifically around products, around struggles that you've had, feel free to drop them in the chat. And in the live feed, we are super excited to get this started. Okay, Kaylee, I think we've got everybody admitted and we're muting as we roll. If you'll keep on watching for everybody to mute, and if you'll please keep your phone muted, as we do have some amazing professionals on with us tonight, and we want to be very conscious of their time. So you guys, tonight's broadcast is especially brought to you by a group of ladies who are very, very passionate about women's health, gut health, weight loss, and making sure that we get really high quality and relevant information out to the industry. So you guys know Dr. Casey Bond. Casey's wave at everybody. She's going to be one of our speakers. We've got Chanel Jepson. She's actually the developer of many of the products that we love and that we use. And then we've got Robin Packard. Robin Packard has had tremendous success with weight loss. She's also over 100 pounds, and she's coached hundreds of people to do the same thing using supplements and food. And so tonight we're really excited to bring to you a special broadcast about a semaglutide empowerment. We want to talk to everybody on here, whether you've considered it, maybe you're not considering it, maybe you're currently on and using a form of the semaglutide, or maybe you've used it and you are having some effects from it, or you're wondering how you're going to maintain, or you're moving forward with your journey. So we want to make sure that we talk to everybody tonight. And we are super excited. So first off, I'm going to introduce to you Dr. Casey Bond. Casey is just an amazing woman. She is absolutely brilliant. Casey is an associate professor of pharmacology pharmaceutical science at the Texas Tech University Health Science Center School of Pharmacy. She has a PhD in pharmaceutical sciences with a background in drug delivery of novel breast cancer chemotherapeutics to the brain. Now she is primarily focused on teaching the anatomy, physiology, and pharmacology of both the nervous and endocrine system, along with leading the veterinary pharmacy elective. So I don't know anybody better that could start us off and kick us off than Dr. Casey Bond. And Casey, I am excited to hear from you and just learn and absorb everything that you can tell us, Casey, because I know you are definitely on the medical front. So Casey, take it away.
Okay, can you hear me okay?
Yes.
Okay. I'm so excited to get to visit with you guys. I will put out the disclaimer. Remember that always talk to a medical provider about anything regarding you and your decisions, and do your due diligence, and you've got to find what works for you. So I do want to give you a little bit of background about the semaglutide, kind of how it works, where it came from. I'm sure a lot of people have heard about it, what's going on, all the buzz in Hollywood. So just to give you a little bit of a background, so semaglutide, and that's actually the way you say it, semaglutide. We want to say it semaglutide because that just makes more sense, but the manufacturer has said semaglutide. So basically this is a drug that's been originally indicated for treatment of diabetes, right? So that means they've got high blood glucose levels. And so the drug was created along with a group of drugs that are all very similar in the way they act, and they're called incretin mimetics. And what this drug is basically designed to do, its mechanism of action, there are these basically these hormones that are released from your small intestines every time you eat. And it's this beautiful mechanism where when the food comes into your GI tract, the small intestine starts with absorption. You basically get these hormones that are released into the body, and they help regulate your blood sugar levels. So some of the things that these hormones actually physiologically do is that they increase your insulin secretion, right? So remember, insulin is our molecule that helps us push like all of our energy molecules from the blood into our tissues. So that's not just sugars, that's proteins, it's carbohydrates, it's like other carbohydrates and fats. So insulin is kind of like the key to unlock the tissue to push the energy molecules in there that we need to run. And so we know that a lot of time in diabetes, blood glucose is high and insulin is either really low or the body's just not responding to it. So when you eat, once again, these hormones are released by your small intestines, and they go out and they increase insulin secretion. They slow down your gastric emptying, and that means it allows your body to more slowly increase blood sugar levels and allow for more absorption of nutrients. They increase your satiety, which is your fullness. So they're also causing that, like, hey, I'm full, I need to stop eating. They decrease glucose release from the liver, which is one of the places that we store glucose in between meals. And so all of these mechanisms together naturally happen by this class of hormones. Well, what semaglutide does is it mimics this action in the body. So you're going to hear about different drugs in this class. So there's liraglutide, exenatide, semaglutide, there's a bunch of them. Well, then when they have a bunch of the generic drugs, then they all have different brand names. So semaglutide specifically, its brand name is Ozempic. Okay, and it's also, and that's the injection form. So the way that this drug works is the person has high blood sugar levels, they've got diabetes, whatever's going on there, go to the doctor writes the script, pharmacist fills it, and it's an injection. So you're going to inject that into your body, and it's going to help mimic that natural process. Well, the way that a lot of drugs came about, funny story, this is how Viagra came out, is that it was originally a blood pressure pill. And they were like, what an interesting side effect. Maybe we could market it this way. And here we are. So with semaglutide, that they noticed that the people that were taking this for diabetes control were losing a lot of weight. And so that's one of the big issues. We want to try to get your weight off. Sometimes that's going to increase your blood glucose levels that go hand in hand. So weight loss is one of the ways we can help reduce blood glucose. So that was kind of the way that they were like, wow, this is really cool that this is happening. So with that being said, we don't have an official indication for the use of semaglutide as a weight loss medication. If the FDA goes ahead and rolls that out, that's going to change the whole landscape of what's going on in the country right now. Because as of right now, it's indicated for diabetes. But what physicians have the power to do is that they can also say, like, for example, there's a state called metabolic syndrome where there's 5 different components of it. But if you have 3 of those components, say like it's an elevated A1C, which means like long-term blood glucose levels are high, elevated cholesterol, and potentially like a high body mass index so that you've got some extra weight on you, they can then say if 3 of those 5 parameters have been met, I can write you an off-label prescription for semaglutide, and then you can take it and help to lose weight. So this has been, it's a great discovery, guys. We've got a sedentary society, desk jobs. We're the one country in the world that everybody has a car. Go to Europe, everybody walks everywhere. They do public transportation and walking. Here we have a car, so it's been a wonderful thing that we've discovered this. And so with me talking to you about it, I don't want there to be any guilt or anything like that about it. It's a wonderful medication. But what we want you to see too is that with every medication, even aspirin and Tylenol, there's always adverse events. There's always things that you have to think about when you're taking it, especially when we're talking about weight loss, because within the pharmacy community right now, it's kind of seen as a Band-Aid. People are taking the medication, they're getting the weight off, but they're not addressing the habits. They're not addressing the issues with food. They're not addressing like their diet in general. And so they're getting the weight off, but then if their insurance stops paying for it, or they go back to having to self-pay, it's really expensive. And then it's at times no longer an option. So if you're using it, that's awesome. Let's also make sure that we're working on nutrition and we're working on our movement and we keep our water intake high. Everybody should be on a multivitamin so that you're hitting nutritional deficits. So there's it's a great product out there, but we want you to see too that whether you've taken it and maybe you've stopped taking it and then you've started to put weight back on, we want to come alongside you and show you how whether you're interested in taking it or already are taking it, that our system is going to be able to help support you better, help with nutrition, help with energy and overall wellness to ultimately get you feeling better and living your best life. So I think there's just a couple of things you're probably wondering about, like all of the scary things that you hear about it. I mean, guys, if you drink too much water, you could technically die. There's always going to be contraindications with any medication. Some of the ones that they're looking at right now, I will say it does have a black box it used to be called a black box warning. Now it's just called a box warning. That's the highest level of safety precaution a medication can get by the FDA. And it does have one for the development of thyroid cancer. The thing is that they've only seen that happen in rats and mice. They've not seen it happen in humans. So there's what they're saying is that we haven't seen it happen in humans yet, but we haven't seen the long-term effects yet. So they're trying to put together some clinical studies to see, is that really going to happen? You're going to hear stories about different GI effects because we're talking about altering, your GI tract in general, because we're looking at slowing gastric emptying and blood sugar levels and all of this kind of plays a hand. So, yeah, so that's just kind of wanted to give you like the 30,000 foot about, what this drug does and just give you a little bit more information about it. And once again, don't ever feel guilty if you're curious and you want to know. I mean, talk to your doctor about it. Do your research, look around, talk to people. Everybody in Hollywood's been dropping weight over the last 18 months. And you want to know how? It's not with those $18,000 a month personal trainers. I'm just saying. So, Crystal, did you have any questions or anything you wanted me to touch on?
Yeah, I wanted you to talk a little bit, Casey, just about like how nutrition can come along and how you can use, you do not have to go down this route if you choose not to. And talk a little bit about how when you do use something like the semaglutide, it's similar to like using a SSRI, your body quits producing it as much, some of those things that we talked about.
Yeah. So, like I said, the pharmacy community in regards to weight loss, it's really kind of seen as a Band-Aid approach because the patients that are taking it, they see the results really quickly. They're encouraged, drop the weight off, and then they stop taking it because it's no longer needed. And then the weight's going to come right back on. That's why it's so important to have the nutrition support and changing your lifestyle and getting moving. And also when you reduce your caloric intake, unfortunately, that usually means that you're not getting the very diet that you need. That means you're not getting the macronutrients or micronutrients that you need. A lot of times too, remember, if you're taking this medication, you've slowed your gastric emptying, you've slowed everything down. That means everything in the tube slowing down. So what's it going to put you at a risk at? Developing constipation. How do we prevent that? That's with a healthy gut. And that starts with probiotics, gut support, enzymes, and all the things that Chanel's going to talk about in a minute. So overall, I mean, the important thing to remember is that you have to stop. The behaviors have to be addressed as well. It's just like with weight loss surgery. Some people are on their deathbed and they need it and they have to have it. But once again, the weight can still potentially come back on. And we see it happen if you don't address those. So, when you take something like semaglutide and it does interact with insulin and the pancreas, which is the organ that secretes insulin, we haven't seen those long-term effects yet. We can't say for sure, like, is it going to stop the pancreas from producing insulin? Well, probably not. It causes an increase in insulin, but it also lowers your blood sugar levels. When blood glucose goes down, the pancreas senses that and it shuts down insulin secretion. There is a balance. It happens all day, but we don't know. Once again, we don't have the long-term data to be able to say what is and isn't going to happen. I know that people who have any sort of issue with constipation, you've got to be very, very careful with this, just because it slows everything, and then that can lead to backups. And then if you're not getting enough water intake, once again, constipation, and that can be miserable. And so So that's something that you want to think about. And remember too, that within like with our system and with supplements and wellness in general, it's hitting everything. So our probiotic and our products and stuff not only help with overall gut health, they help with the hormones that are produced in your gut. And you just don't kind of think about those things, because usually you think about like neurotransmitters, things like that all happens in your brain. That doesn't. There's so much interaction with your gut and overall health, and especially mental health. So it's so important that you're taking a multivitamin, that you are increasing the protein that you're taking in. Protein leads to building of protein. And so you've got to have protein intake coming in, especially even if you want to start walking every day. So, this is where, so I'm just such a believer in the system and products to help you be healthy and live a better life. I don't want to be tired all the time. I want to have the energy to go walking with my kids every night. And that's where I get the help from the products and stuff. And I believe them. And I've done my research on the ingredients. And Chanel, she's smart. Oh my gosh, y'all, like she's done her homework and she knows why she did it. And she specifically put in ingredients for that product. There's no extra fillers. There's no extra stuff in there. And she's constantly worked to improve and make our stuff even better. And so I think it's great that we've had her and her skill level and stuff, because she's amazing. So, I think that this is just, once again, you've got to have products that are helping your body stay well. You've got to have nutritional support. You've got to have increased protein in your diet. And most of us don't take it in, which is food. The energy and helping with sleep, all of it together. So yeah. So anything else, Crystal?
I was just looking in the chat. I think that's a really good coverage of it, Casey. Is there anything like specifically, like just leaving us with a couple more thoughts, like just last thoughts as far as being like a pharmaceutical professional? Like if you were talking to somebody who was healthy, who was just looking at this for weight loss period, how would you advise move on? Like what would be your recommendation, knowing what the side effects, everything?
Mm-hmm. I would say if you don't have blood sugar issues, I think that you should just stay away from it. I don't know. There's a personal decision there with that. I just know that your blood glucose homeostasis in the body, it's just such a beautiful system that it's just so purposefully designed, and the balance is there. And one of the easiest things to clear higher levels of blood glucose is skeletal muscle. That's the primary user of glucose in the body. Going walking for 10 minutes, 20 minutes the next time, just getting moving is going to help drop those blood glucose levels over time, rather than trying to supplement to trick your body into doing something. Because it's basically, guys, we're manipulating one system to affect another system. We're, manipulating the GI tract to affect the blood glucose levels to then affect fat deposits. And so I just keep wondering, seeing all this, you're affecting a lot of different things to get to one goal. So I would say, reach out, get some accountability, get moving, talk to the coaches on here. There's accountability groups you can share your activity on your Apple Watch. Start with small habits every day of changing nutrition. Because if you're just taking the medication and you do not change your habits and you continue to eat junk, you're basically just going to be wearing out your GI tract and this system that's trying to regulate. So I would say, try to do everything you can before you get to a point where, that you're taking this. Because once again, it's a Band-Aid approach for a greater problem. So, but that's not to guilt you guys. Like if that's what you found and that's working for you, that's fabulous. You do you, boo. Just remember that you've got to make sure that you stay on top of those nutrients to keep your body running the best that it can. And that's, to me, it's got to be supplementation. We just can't get it in the American diet.
Absolutely. And then also talk a little bit about what happens when people stop taking it because they can't take it for long periods of time for weight loss if they don't make this.
Right. And remember too, like if you go to your doctor, you see he says you've got the metabolic syndrome. We're going to go ahead and write this. You only need 20 pounds off. You get your 20 pounds off. And he's like, well, I can't continue to write you a drug that you don't need anymore. So it's gone. Well, if that was your dependence and you didn't change your lifestyle and now you've altered your GI tract and you didn't fill in those nutritional deficits, the body is going to try to readjust somehow. And usually it's going to be with that weight coming back on. And so that's why we see it as a Band-Aid approach. It's that it's going to work. It's designed to work. And so, we've got to make sure that, once again, that we're addressing that behavior because, you know, I don't eat the best. I mean, none of us do, y'all. Everybody wants some cookies and cake every now and then, but there's a balance of enjoying your life, getting to a good place where, you know, that you can move and be active and that sort of thing. So yeah. Okay. And then what else did you ask? I think you asked,
long-term
constipation
effect.
is no joke. The constipation with it it's bad.
Yep.
So, and then you're going to have to probably take something to fix that, which is once again, then adding in, which is usually going to be magnesium is where they're going to start with, or something else that can then, it's just going to alter then the absorption of nutrients even more. So Manjaro is just a different drug in that class. So it's not semaglutide. It's another one in that class. So it works similarly, just not, just a little bit more simplified, but very similar.
Absolutely. Absolutely. Well, Casey, thank you so, so much. This has been incredible information. We're going to keep rolling. I know Casey may be able to drop some answers in the chat if she's got some time. And if not, no big deal. We can get to it here in a bit. But up next, I'm going to turn it over to Robin and she's going to introduce our next speaker.
Okay, guys, I'm so excited. I hope you can hear me. This is one of my very favorite people in the world. I girl crush her so hard. She's smart. She's beautiful. She's kind. She's funny. She's just all the things, Chanel. She's a food biochemist. She is a functional nutritionist. She has been in our industry for a decade and a half, formulating products. She knows the ins, she knows the outs, she knows the whole deal. She's amazing. And she's going to educate us on naturally boosting our GLP-1. And so I'm going to turn it over to her because no one could explain it better. Thank you so much, Chanel, for taking the time to do this.
Thank you for the introduction. That was lovely. I'm going to put you in my pocket. Yes. Can you guys hear me okay?
Yes.
Okay, perfect. And then you guys will just be going to the slides, right? Because I can't click on the
if I don't move it fast enough, just tell me next slide, Chanel.
Perfect. Love it. Okay, you guys, I think a lot of times we want the simple, like we like the science stuff. Casey, you did a beautiful job explaining what it is. I just want to talk really quickly about side effects because you talked about those side effects. But I'm going to list out the ones that are the most common with those drugs because science is cool, and education is cool, but actionable education is the best. When you can actually take the education and then apply them into your life and get results from them. I think that's what we want to offer you tonight is actionable education. So some of the side effects are nausea, GI pain, excess gas, stomach discomfort, acid reflux, vomiting, and fatigue. And I want to talk about, okay, if you aren't on those drugs and maybe you're dancing, I call it dancing with the devil, but you're kind of dancing on the idea of, should I do this? But maybe you want to actually produce GLP-1 on your own, which is what your gut does naturally. That's what it's there for. Or maybe you are on these drugs now and you want to know, okay, so I'm on these, how do I mitigate these side effects because they're terrible? Or some of the other side effects is when people are losing muscle and their skin is sagging and they're just not looking as youthful as they did before. Maybe it's I call it kind of accelerated aging, right? So those are some of the things that we're seeing. So I want to talk through, okay, how are we going to produce it naturally? If you're on it, how do you mitigate these side effects? And if you're just coming off of it, how do you fix some of those things that Casey said, like with a multivitamin, things like that? Okay, so let's go to the next slide real quick. Let's see, I think one more. Okay, so how to increase your GLP-1 naturally? Go to the next one. Can you guys see the slides? I don't know if you guys can see the slides. No, you can't see the slides. Okay. All right. So, sorry, let's just go to there's one main slide that has all three, and maybe that would just be the easiest just to jump to that one. Okay. So your GLP-1, like Casey said, it's actually naturally produced in the gut by your L cells. And these are 3 ways to boost your GLP-1 naturally. So I want to talk about how to do it naturally first, because I think that's where most people are going to be at. Maybe you're sitting at a little extra weight, maybe you're overweight or you're obese or morbidly obese, and you just want to lose weight, but you want your body to do what it was always meant to be, right? We were not meant to be overweight. That is just happens through all these different factors. So the first one are prebiotic fibers. So if I think that this is one of the most important vital things that people are missing in their diet is fiber. And this is why. So when you ingest fiber, your body is going to take that and it actually absorbs stuff along the ways. That's why it's always better to eat a fruit than just the juice, is because that fiber actually slows down that conversion into sugar. But one of the key things that fiber does for GLP-1 specifically is that it is eaten by your probiotics, by that live bacteria, and then it creates postbiotics. So these are short chain fatty acids like acetate and butyrate. And these are going to help stimulate the production of the hormones in your gut that are going to help you feel satiated. So if we were to pull out specific singular products that this is going to do, that this is going to help with, number 1 would be Complete Prebiotic. It has 4 grams of prebiotic fibers plus plant polyphenols. And all of these, your good gut bacteria, it's going to nosh on, and it's going to create these short chain fatty acids that's going to help that those are best released in response and creating that GLP-1. So it's going to activate those gut hormones and things like GLP-1, but there's other ones, right? There's also, I'm going to mess it up, PPY. But it's the satiating hormone, or you have ingredients in the brand new trim sticks. There are prebiotic fibers in there. There's organic tapioca fiber and there's organic baobab fiber. And there's also in there potato protein extract. Potato protein extract helps stimulate the hormone CCK, which is going to help you feel satisfied for up to 3 hours. And that's really what these drugs are trying to do, is to create that satiety so that you feel satisfied. And I think a lot of people are missing that because I think it's roughly, I think 8% of Americans are eating enough fiber a day. Only 12% of Americans are metabolically healthy. We are not doing even the essential things to produce it. And so now we're focusing on this drug to artificially inject ourselves with it, when really it's pretty simple. It's easy things, just the basic essentials of nutrition that is going to help your body produce those. So fiber, like I said, Complete Prebiotic, that has a ton in it. 4 grams of plant polyphenols, prebiotic fibers, those deep purple colors. Those have a type of polyphenol in them that are great also for your immune system and even for your skin and collagen production. But then we also have the fiber in the trim sticks. You have 2 grams of dietary fiber in the trim sticks. And how much fiber do you need to get in daily? It's about 25 grams. About 25 grams of fiber every day. And that's going to drastically improve your GLP-1 production naturally. And so you have 4 grams in Complete Prebiotic, you have 2 grams in trim sticks. A lot of people will drink a couple trim sticks a day. So you can get a pretty good amount just from supplementation, especially if you're one of those people who really just doesn't like fruits and vegetables. Fiber is an easy supplement to take. And we also have diversity. That diversity in that gut microbiome is really going to help with that GLP-1 production. Okay, so that's fiber. The next one is probiotics. Really cool findings in probiotics right now, but probiotics help with we call it the fat loss probiotic, but it's Akkermansia municipal. And they did these identical twin studies, and they found that the twins with high Akkermansia levels were actually going to be with high Akkermansia levels were actually the best weight. So they were at a healthy weight. So you have those identical twins, and it's really interesting because their genetics are exactly the same. And sometimes I get a little annoyed with the advertisements I see for these GLP-1 agonists, these semaglutides, I see it's like overcome your biology. Well, it's not necessarily like it's acting as if the only reason you have this problem is because of your genetics. But we're finding that that's actually not the case, that a lot of it can be epigenetics or lifestyle. Epigenetics is like learned genetics from your like mother, family, whatever. And so it's creating this akkermansia, and these probiotics, those are the ones producing these short chain fatty acids. And that is directly helping the production of GLP-1. And so what's great about this is this means it's going to slow your gastric emptying naturally, but not too much. Like Casey talked about, you do not want to slow your digestive system too much, because then you have constipation. Constipation is terrible. If you get constipated, obviously it's like really uncomfortable feeling, but people who get constipated, a lot of times it shows up in their skin as acne or skin rashes or something like that. And so by fixing the gut is really the epicenter of health, and it's connected to all these different things. It's connected to your mood, it's connected to your weight, your fertility, all of these different things. And so by taking a probiotic, that is really going to be a key way in increasing those good gut bacteria that are going to help your body produce this naturally. The third way to boost it naturally is whey protein. It was really interesting. There was a study done on, it was the same amount of protein, but it was chicken and rice versus whey protein. And whey protein actually stimulated more GLP-1 secretion than the rice and chicken alone. Whey protein is an amazing supplement. So we have products that have whey protein, and other proteins too are great, especially because one of the side effects is that people are losing muscle mass, and so they're losing elasticity and collagen, and so they're getting, they call it Ozempic face, and it's just like, it's really aging people and the way they look, and so they go into it wanting to be more confident, and then they're walking away not feeling as confident because of some of the side effects like Ozempic face, and then muscle deterioration. And that's why it's so important to get in that protein as well. And like I said, whey protein, just for some reason, it stimulates the production of GLP-1, which is great. Okay, I'm going to answer this question real quick. What if you're lactose intolerant? Will whey be bad? Hey, it really depends on, so if you get a whey protein isolate, an isolate is really just isolating that protein. And so a lot of times you're not going to have a problem with it because the lactose is removed. Lactose is a sugar that's found in dairy. And so that's removed. So whey protein, you can double it up. This study specifically showed that 17 grams of whey protein really boosted that GLP-1 production. So if you're taking like a 10 grams of protein, just double that scoop to get up to that 20, and then you'll hit that. So really, realistically, if you were to look at this, if you take your prebiotics every day and you hit that 21 to 25 grams of dietary fiber, if you're a woman, I believe it's 30 grams if you're male. If you hit that every day, if you take your probiotics every day and you take whey protein every day, those 3 simple steps could make it so that you don't need to artificially inject yourself with a GLP-1. Now, say you're sitting there and you're like, hey, Chanel, I'm actually already on it. Now, what do I do? Okay, so some of the things that we had just talked about was the muscle deterioration, getting in that protein, whether you are wanting to produce it naturally or you're getting it artificially, you still want your body to produce it. So take all of those steps, those 3 things from phase 1, and then just put them here. And that's when, because you want to do all of these things, because I know she kind of talked about it, but like SSRIs, all of these drugs, like I think of your body as a teenage boy, and you tell him, hey, I need you to take out the garbage. He starts taking it out, but then you just start taking it out for him. When you stop taking out the garbage, he is not going to just start taking out the garbage, right? Like, so when you do things that your body is supposed to do, your body will stop doing them because it's that efficient. So instead of giving the body what your body should be doing, we want to give the body what it needs to do what it's supposed to do on its own naturally. But drugs are here, and they are here for a reason. And I know that this drug has helped people who felt like they could not do it on their own. And if you're one of those people, then my advice to you is get in your fiber, your daily fiber, because you are going to get off this drug and you want to make sure that your body is producing its GLP on its own. So take your fiber, take your probiotic, take your whey. But now you have the idea, if you have those side effects, if you're nauseated, excess gas, stomach discomfort, acid reflux, add on our complete digestive aid. This has herbs that are going to soothe the gastrointestinal tract, it's going to stimulate your body to produce like the stomach acids that it's supposed to. They're called digestive bitters, like ginger is great. And then you also have these digestive enzymes that are going to help break down your food into those usable pieces. So that is our complete digestive aid. That could be a huge help, especially for nausea. Like I said, those botanicals just kind of help soothe that gastrointestinal tract. So that's another one to add. Another thing is that Casey talked about is deficiencies. So adding in an action, a complete multivitamin, multi-mineral, in order to really bridge those nutritional gaps that you're not getting because you're eating less. Omegas are so important for reducing inflammation. Inflammation is one of the causes of obesity. And so you have even things in our environment called obesogens, and they are causing obesity through inflammation. So omegas help to reduce, or omegas really help your body to mitigate inflammation. Our Zingulars has EPA, DHA, and then EPA. So it's kind of like the forgotten omega. It's a really important one to help with regulate that. The full tummy tamer, complete prebiotic, complete probiotic. I just talked about digestive aid. And then collagen. Collagen is going to help with that Ozempic face in the way of, well, because you really don't want to lose weight too fast. That can be really hard on the body, but we want to help stimulate new collagen production as fast as we can while you're losing weight, in hopes to kind of like mitigate that side effect. Complete collagen, it has hyaluronic acid that's going to stimulate new collagen growth. It has all those different types of collagen. It even has digestive enzymes to help break down that collagen. So it's really a complete product. The other one I would add on is trim sticks. The new dragon fruit formulation specifically has things in it to stimulate those gut hormones. Like I said, potato protein stimulates CCK. That helps you to feel fuller for longer. It has in that fiber that is going to help slow down like food that you're intaking. So if you like drink it with a meal, it would actually help that glycemic response. It has so many amazing things for blood sugar in there. It has the chromium, and we have a really specific chromium amla fruit shilajit complex in there, and then the clinicals that show to help with blood sugar response. So that's a really great product to add on. Now, if you're coming off of it, same things apply. You're going to want to do everything on like phase one, right? But then adding in the support, because if you've been on it for a while and you have those deficiencies, you're going to want to start taking things like action and omega and even the tummy tamer to make sure that you're kind of helping to like restore your gut after you had something that was so harsh on the gut. Gastric paralysis is one of the side effects that is happening right now. And we want to make sure that you are able to like keep your system. Sorry, I like hurt my finger, so I can't really do the movement right. But you have this thing like that it like it's like an accordion, like it pushes food through. Sorry, tongue twister. Anyways, it pushes the food through when you have probiotics. Probiotics and your good gut bacteria produce serotonin, and serotonin is actually what helps with the that word. Why can I not say it? Anyways, it helps to move food through at the right pace. And so we want to do that naturally. So just to recap, I just want to make sure I covered everything. So slows digestion to keep you fuller for longer by producing butyrate, activates your gut hormones, GLP-1, CCK. That's going to regulate your appetite control. And then just supporting those good gut bugs, which is going to help with your blood sugar and your blood sugar and metabolism and all of those different things. Thank you, Cindy. You know what? I just need you guys to interpret me. All right. Let me look real quick. Let's see. Is there a blood test to show how much GLP-1 your body produces? Yeah. Oh, thank you, Casey. Exactly. That's actually really hard to measure. But okay, so all of those things together can really help. So whatever phase you're in, and there really is no shame. If you were on these drugs and you felt like that was necessary to you, I'm just a huge believer in body autonomy and informed consent, that you understand, okay, so I'm going to take this drug. What are the side effects? How do I mitigate that? I'm taking this drug so that I can lose weight. What are other things that I can add on to help me lose weight, not just while I'm on the drug, but long after the drug. And so that you're not yo-yoing. There is nothing more frustrating than losing weight and then gaining it all back. And I would just hate if anybody's on this drug and you take it and you lose all this weight and then you gain it all back because you weren't aware that you could actually produce this hormone naturally, and that you could keep the weight off for forever. And so hopefully that gives you guys with a few tips on things that you can do to produce it naturally, to mitigate side effects, and then just to restore your body after taking the drug. Anything else you guys wanted me to cover?
I love it, Chanel.
Thank you.
That was awesome. So will you talk a little bit too, like I know Casey touched on the longevity of the semaglutide and people using it for weight loss. Will you speak a little bit to the longevity of that, and then how, the supplements can come in and really help your body kind of take over from there?
Yeah. Okay, wait, sorry. Say the first part that you want me to cover.
Well, there's a lot of people that are asking me in the chats about how long you can stay on the semaglutide. People are curious about that. And I know that's probably a variable person to person thing. Like there's not necessarily like a one box fit answer, but talk about that. And then leaning into what you would recommend if you're coming off of it, where you would start at, like what dosage you would start at. Like everybody's like, how much do we take of what? Do we take 2 probiotics a day?
Oh,
Do we,
yeah.
you know what I mean?
Yeah. All right. Yeah, that's perfect. Okay. So the longevity, everybody can be on the drug for a different amount of time, and it totally depends on your situation. So say you were taking somebody who's morbidly obese, once they get down to a certain weight, their doctor would take them off of it. I know some doctors who are only allowing people to be on it for 3 months. Some are 6 months. So that really is doctor dependent. I don't think there's a standard across the board that I'm aware of. Casey, you can correct me if I'm wrong on that one. But so once you get off of it, well, and it depends on what you're taking it for. Like there's certain ones that are approved for weight loss, but like Ozempic, I believe it's still just for diabetics, but then you have Wegovy and the other ones that are for weight loss. So if I would not recommend it, and I don't think any doctor would recommend that this is like a lifelong drug for you. Really the goal is to lose the weight and then get off of it, right? So if I personally, I'm just going to put mine because I don't want to prescribe anything. I don't want you to take this. Like you do need to consult your doctor. However, if I was on this drug and I was getting off of it, I would probably do things like I would take 2 probiotics. I would up my fiber. Fiber you do have to be careful of because most people, and one of the things that we are seeing is that GLP-1 production slowed down before the person became diabetic. So they're thinking that it's the slowing of that production that's causing this, but we don't know for sure. There are still so many unknowns on this drug also. But if I would be, okay, I want to produce it naturally, so I'm going to get in fiber. But most people who are in this situation, they are not intaking enough fiber, so their microbiome isn't quite ready for it. So I kind of think it like a fire. And if you were to have a fire, you wouldn't want to just like add a ton of wood at one time. That would smother the fire. And that's kind of what happens with your probiotics. You don't want to give your body too much fiber in the beginning if you're not used to it. So usually I say, okay, like if you're on this, take 1/4 of a complete prebiotic. Do that for a week. Then take half a packet. Do that for a week. Take 3/4 and a week. And then 1 full packet every day for a week. And slowly and methodically up your fiber intake so that you're slowly adding wood to the fire or slowly adding fiber to the probiotics. And that they will just grow your good gut bacteria. And it sounds gross, but you want this big, beautiful bacteria community because that is what's producing those short chain fatty acids. So that's how I would do fiber. Work up to 1 packet. And then after that 1 packet, work your way up to 2 packets. Like I said, you have to get like 25 grams of dietary fiber a day. And that's really difficult for a lot of people to do. So work your way up to that. Probiotic. You might have a lot of bad gut bacteria. I've noticed that as I have watched people have these detox symptoms, they just don't have a lot of good bacteria that's fighting the bad bacteria. And so I'm more of the person of like, I want to get it over with. So I will take 2 probiotics, kill all of the bad. I will go through what we call a healing crisis or bacterial die-off. And I will be like, let's just kill these bastards now. And like as much as we can, as fast as we can. I want them out of me. So that is like the way I would do it. However, if you're one of those people who you're like, oh, I don't want to feel detox. Some people will like open a capsule and they'll take half in the morning and half at night. And that's totally fine. But I would just take 2 a day. After I had my baby, that's what I did to get my microbiome back on track. I took 2 a day every morning. First thing in the morning on an empty stomach. Okay, so that's probiotic. Digestive aid, anybody can take that at any time. I haven't met anybody who has problems. So you could easily take 1 with every meal. And that is really important for people on this drug because you need to, like, you're investing in a meal. You need as much nutrition out of that. And the complete digestive aid is the best ROI you'll ever get because it literally breaks down all your food into those usable pieces. Let's see what else. Trim sticks. I would do 2 trim sticks a day. I think that's best. 2 trim sticks a day is going to be great. That's also going to give you 4 additional grams of dietary fiber, more of that diversity, plus all of that blood sugar control with the chromium. It has choline in it, has a whole blood sugar blend, clean energy blend. So that one's going to be a great one. And then Action, just do Action. I would just do what's on the bottle. I mean, on the blister pack, just do like what it says. Unless like you're really large, all supplements are made to, I think, around 130-pound person. So we can only give you like 1 recommendation, but just know that your weight might change how much you need. Like if you're a 250-pound guy, you could take more safely of things. Omega, same thing. Just do what it recommends there. And then lean, 2 scoops. Action recommended 2 daily on the bottle. Okay, perfect. And then 2 scoops because you want to hit that 20 grams of whey protein. And that's going to be the best way to produce that GLP-1 naturally. So that's kind of how I would do each one of those products. Just building your way up, going through that healing crisis. You want as many of the good bacteria and you want to kill a bunch of that bad bacteria. And so just know that some of those, they're side effects, but they're not side effects of it. It's just the natural like evolution of killing all this bacteria in your gut. And what's awesome about this is you'll become like, I'm in a phase where I was borderline obese. I had cystic acne. I was a size 12, went down to a size 2, and I have remained my weight after 2 babies. Without having to count a macro, I really just give my body what it needs to do, what it needs to do. And you can get there. And I think that's what's beautiful about this is, yeah, you don't want to be on something that's causing like problems. Like the thyroid cancer is so scary to me. All of the side effects are scary to me. But you just have to, oh, little girl saying hi to me. Hi. You just have to kind of like weigh out the pros and cons for yourself, and just see what's best for you and your body. But hopefully this gives you some like actionable items of like, okay, I'm in this phase. This is what I'm going to do. But also whoever invited you to this call, get with them and they can kind of help customize things to meet your needs. Did that answer it?
Yeah, that's amazing, Chanel. And then how many scoops of collagen a day? I think that was asked too.
Oh, how much collagen? So you could easily do like three scoops a day, 3 to 4 scoops a day, and you would be fine.
I do 3 a day. I'm addicted to
Yeah.
it.
I know, me too.
Wonderful. Oh my gosh, this is so good, you guys. Are you guys loving this? Lori asked about the trim sticks. The original trim sticks are good. There's just a little bit of added benefit with the dragon fruit, correct?
Yeah, they're just like they're just a little bit different. But they both have fiber in them. They're just different sources of fiber. And I would say the original trim sticks is more like a stimulant. So like and it is quick, but it will still give you weight loss, but they're just a little bit different.
Very cool. Very cool. Well, Chanel, thank you so much. We know that you're at your daughter's soccer game, so we're going to go ahead and let you jump off. You are amazing and beautiful and full of information. So you guys, thank Chanel. Give her some love in the chat. And then next up, we've got the Robin Packard. Robin is absolutely amazing. If you guys don't know Robin personally, she's one of my very best friends, but also I have watched Robin lose 100 pounds once, and then she came back and gained some weight through her divorce, which life happens, right? And then she's lost it all again. Never used any pharmaceuticals. She did it all through nutrition and food and healing her body. And I love Robin so much, but sometimes when we eat supper together, I'm like, stop. You're eating donuts and milkshakes and coffees from Starbucks, and you've obviously healed your body from the inside out. Robin also has fought PCOS, you guys, which is a very long and strenuous battle for women. If you don't know anything about it, Robin's going to probably talk a little bit more about that. But Robin has been through the gamut of it, and she has literally cracked the code on being able to lose weight, maintain it, and eat carbs, which is what we all want, right? And Robin is 45 too, by the way. I'm just going to throw it out there because I think she's absolutely stunning and beautiful. And take it away, Robin. We just love you.
Thanks, guys. I'm so excited to be on here tonight. Thanks for tuning in. I know this has taken a little while, but it's so full of good information that you need. I love where we're at in the world right now because obesity is rampant in our country. We eat a lot of processed foods. We have, for one, being the powerhouse that the United States is, we are one of the most unhealthy. We are one of the most unhealthy countries in the world. And like Crystal said, in 2012, I was morbidly obese. I was 100 pounds overweight and had tried everything. Some not so healthy. I tried phentermine, all kinds of stuff. And I had 3 little kids. And honestly, I was hopeless that I would ever lose weight. I didn't grow up overweight. I got a Depakote shot when I was about 18 or 19. And that went to a 30-pound weight gain immediately. And then I started fighting my weight after that. It wasn't until after my 3rd child where I was diagnosed with PCOS and endometriosis, all hormonal issues. Endometriosis is masses in your body of uterine tissue. So what I was going to talk to you about, I came to Singular because I saw a friend lose 74 pounds and it gave me the faith of a mustard seed that I could do it myself. So I joined in. I lost 84 pounds in about 7 months. And I maintained that really well for about 5 years. And then I went through a divorce. My dad died, and I gained some back. And I found what I did the first time didn't work as well. And I had to change things up. And I think that's what's important about this and working with somebody that you trust in the weight loss industry is because I have a bachelor's in biology. I also have a dual bachelor's as a medical technologist for working in a lab. And the weight loss industry isn't a one size fit all deal. Everybody's body responds differently to carbs, protein, fats, all the things, to different products. And just because one thing didn't work for you, that doesn't mean you can't lose weight. And I'm here to just love everybody where you're at. If you are using semaglutide, I would love to help you with some of the nasty side effects, whether it's your gut health, whether it's the Ozempic face where you get tremendous loss of volume in your face, wherever you are, we are here to help you. If you don't want to use it and you want to go a natural route, that's what we're all about. That's what this is for, education and to help you make a plan or to help you with your clients. So, but what I specifically want to talk about, because I have had 100-pound weight loss and my skin held up relatively well is skin snapback. And the products, so whether you're on semaglutide or you're doing naturally, whatever, if you are one of those people that needs to lose tremendous weight, or you're coaching somebody that needs to lose tremendous weight, we want to talk about the products that are going to help you kind of get there and give the skin the best of its ability to snap back from that kind of weight loss. Okay. So when we're talking about that, we're definitely talking about collagen. Singular has the best collagen on the market. I believe it. Chanel designed it. It is hands down the best. Omegas, prebiotic, probiotic, and global blend. Those are going to be my 5 products that I love for skin snapback. It's funny because when I was losing weight, I was sitting in an oncology meeting because I worked at a hospital, and they were talking about how when they want to know how much toxins are in the oceans affecting whales, they test their blubber, which is fat. They test this blubber for toxins. And it was funny because most toxins can be stored in your fat. So when you lose weight, you're breaking down that fat, releasing those toxins back out in the bloodstream. So what was interesting, I mean, I was in the middle of a 84-pound weight loss, and the oncologist stopped that meeting and he said, it'd be really interesting to test Robin's fat right now and see how much toxin she's releasing. And I literally went home and drank a whole bottle of Global Blend. I hadn't been drinking it before, but I was like, if I'm releasing all these toxins, because Global Blend helps detox your body and get that out. It binds to free radicals. So that's always stuck with me. And anyone that wants to lose a lot of weight, I'm like, you need Global Blend because you're going to be releasing toxins back out into your bloodstream. So I just wanted to talk about that and kind of touch back on what Chanel was saying about if you're not on it, you can help your body produce semaglutide better. And what's funny is when our tummy tamer system came out last October, I got to trial it like the 30 days before. I was at an all-time low of my weight, which was 126 pounds. Hadn't been that size since I was probably in high school or maybe even junior high. And they sent me the tummy tamer, and they were saying people are getting weight loss with this. When you heal your digestive system, it's amazing what you can do. And I'm over here trying it. I'm like, well, I'm not going to lose weight because I'm at the smallest I've ever been. I lost 4 pounds in that month with no more changes, no nothing, just doing that. And one of my biggest reasons why I love the tummy tamer system, and I just like all hail to Chanel, is I come from a family that is rampant with colon cancer. We are, just to be frank, non-poopers. A lot of women are non-poopers, and that's why women especially struggle with colon cancer. So that was my motivator for the tummy tamer. It wasn't for weight loss. It was to help heal that, help get things moving literally. So I just want to talk to you tonight about, wherever you are, get with somebody. Let us help you on your journey. Let us help you coach whatever. If you are a semaglutide user or you're not, there's still products that you need to plug in for your weight loss journey. I'm a non-judgmental weight loss person. Like, I feel like I've seen it all. I've seen every diet on the market. I've seen the hot dog diet. I've seen the cabbage soup diet. I've seen terrible diet, all the things. And what I want you to know is there's hope no matter what you're doing, no matter where you're at. But the biggest thing isn't just weight loss. Kathy's asking if I took metformin. I did take metformin and I took myself off. I'm not recommending you do that. It just made me so sick. But what I want to say is, like, let us help you and meet you where you are in your weight loss journey. No matter what you're doing, because there's still nutritional gaps. If you are taking semaglutide, most people are barely eating or whatever. And like, some people are kind of abusing the system a little by eating bad foods instead of, the nutritionally, dense foods. So let us help with that and formulate a plan for you. Just like our lean shake contains whey protein, which is going to up the production of your body naturally on semaglutide. So I'm excited. There's been lots of good information on this, but what I want you to know, no matter where you're at, there is hope. If you're a semaglutide loser, let's address those side effects, the constipation, the Ozempic face, the loss of body mass, the loss of muscle that you don't want. You, especially if you're a woman, you do not want to be losing that muscle. That's why protein is so important. I rely heavily on a high protein diet. I don't worry so much about carbs anymore as I do getting in a lot of protein. And what's crazy is, like Crystal says, you know, and this is not an exaggeration. 10 years ago, if I would eat a donut, drink a Coke, maybe the next day have a donut, I would gain 5 pounds and then struggle getting it off. But when you heal your body, it's amazing. Now, occasionally I can have a Coke or a donut. I'm not recommending you go on a donut diet or a Coke diet. I'm just saying, when you heal that system, you can have a treat occasionally and it not affect your weight. But I'm not kidding when I say a PCOS girl can have some carbs, bad carbs, and gain 5 to 10 pounds in a weekend and then struggle getting it off. And it's just a really hopeless cycle. So what I hope everybody walks away with is get informed, get educated, and then figure out what you need to do to finish your weight loss journey or maintain. And I will tell you, that is the biggest thing about weight loss. It's not just losing it, it's maintaining it. So what scares me somewhat about the semaglutide is people that once their coupons run out or they can't afford, you know, whatever a month, is how will they maintain that weight? And I want to be able to help those people produce their own semaglutide better and find a way to continue their weight loss journey or keep the weight off. So I just hope everybody feels like this was a really safe, no judgment zone, whether you're on, whether you're off, be informed. But if you're one of those people that wants to do it the natural way, and that's where I was when I started my weight loss journey with Singular, because I had already tried phenamine, and you do lose weight, but the minute you quit taking it, you gain all the weight back. And I was just really moody when I was on it. So I was looking for a natural alternative.
Excellent information. Thank you.
I have 3 children. I can't be doing anything unhealthy that would up my chances of morbidity or whatever. But so I hope everyone feels really good about this and can pass this information along. I hope you know that we're here to meet you where you are. We want to help you. We want to help if you're more worried about your skin. I'm here to help. Or if you're worried about weight loss or maintenance, just know that there is help available. We can work with this trend and move forward in a way that helps everyone meet their goals. So Crystal, thank you for organizing this. I'm sorry my dogs are barking. They ruin every Zoom. I guess it's just part of life. It's either my kids or my dogs. But I'm so excited for you. And weight loss is my passion. I want to help anyone that wants to lose weight. Like my 100-pound weight loss, I'm maintaining well. So thanks for putting this together. I know it was lengthy. Thanks for staying on. Crystal, I don't know if you have any extra words.
Just, we want everybody to get with who invited them. There was a lot of questions in the chat about what products you should be taking, if, what, when, where, why. Get with the person that invited you to this Zoom, and we will help set you up with a specific protocol. We have amazing kits. We have our tummy tamer, right, Robin? We have the whey protein available, the trim sticks, the collagen. We have the very best. Singular is the Neiman Marcus of the supplement companies, right, guys?
Yeah.
So
one more thing, Crystal. I'll just give you my personal recommendation. When I meet a Robin, and I do almost daily, that wants to lose weight and struggles with the thing, my favorite kit is the X Plus, and that covers the tummy tamer and the X bundle. Just so you know, that's my recommendation when I see a girl in the same predicament as me, and that's what I see work really, really well. I like the X Advanced, I like the X bundle, but I love to tackle the two together. Gut health's important, and especially right now in the world, so much research has came out about your mental health, your immune system, everything is linked to your gut. So that's just my recommendation.
Thank you. Thank you. So you guys, you heard Robin, we've heard from Chanel. The recording will be available soon. Thank you to everybody who jumped on. Get with the person who invited you. And we are so excited to continue this movement to really lock arms and partner with people in the weight loss industry to make sure that we get you the best results possible. Thank you, everyone. Have a fantastic Monday night, and we will see you very soon. Bye, Robin. Bye, guys.